mentioned most patients do their wisdom teeth under anesthesia. Can you tell us more about the common types of anesthesia we use?
Sure. In all of our procedures, we use local anesthesia, which most people know of as Novocaine. This means that if we're doing a patient's procedure under a sedation, we don't have to make them as deep as we would without that. Anesthesia is kind of a continuum, and it goes from the very light anxiety-relieving effects of laughing gas to surgical planes of anesthesia, which of course we don't do in the office, but we certainly do in the operating room. When our patients are with us for a third molar procedure or a wisdom tooth procedure, we usually have them come in with an empty stomach and somebody take them home, and we check them out pretty carefully before we get started with monitors and listening to their chest and so forth. And then we start an IV and we give them some medicine through that first makes them very relaxed and comfortable, and then may take them to a little deeper stage of sedation where they're unaware of what's going on. This is all something that's predicated on the patient's needs and their preferences. When the patient is adequately sedated, we use Novocaine just like you would in any other procedure, and get the area anesthetized so that we can do our work without creating any pain for the patients. Most of the time when we do our third molar procedures, the patients never know that we're giving them Novocaine. They never know that we're taking the wisdom teeth out. When they're all done and they wake up, they're frequently surprised that the procedure is over, and they're very grateful to be able to go home in comfort.
So what do you think sedation dentistry is most useful for?
Sedation and anesthesia are most important for patients who either have high anxiety or for whom this is a very difficult thing to go through. And there is tons of literature, both in our literature and the psychology literature, about the specific anxiety that patients have when they come to either a dentist or more specifically an oral surgeon. And for some people this is overwhelming, and we know that. We respect that. So those folks who have an anxiety that is overwhelming for them, those are patients whom we need to sedate. Patients who are going to have extensive procedures, especially where we need for them to be still or we need for them to be comfortable, there are other candidates for sedation. Patients who've had a bad experience in their history are frequently part of the first group, but we have a special place for them. We recognize that this is common. Young patients who have not had any experience with surgery or anesthesia have to be treated in such a way that they will not go home with a scar, where patients were treated just to get the treatment done and then left to go and develop their own concerns and fears as time goes on. So we look not only to patients who are coming to see us right now, but patients who will be seeing dentists for years to come, and how can we make it easier for them to get the treatment that they need and easier for their dentists to take care of them in an appropriate fashion.